Well, if you avoid going to the dentist, you are not alone. A survey lists the top 5 reasons people do avoid the dentist, and the #1 reason, you guessed it, pain. Well, technology has come a long way, baby, and pain no longer has to be part of seeing a dentist. Today is the first in our 4-part dental discovery series in which we sink our teeth into the latest advancements in dental laser technology, more specifically WaterLase. Here to talk to us about this morning is Wayne Harrison, Vice President of Sales and Marketing for BIOLASE Technology. Wayne, good morning. Thanks for being here with us.
Good morning. Thank you for having me.
I have a confession to make. I don't hate going to the dentist. I actually rather love going to the dentist. I know I'm in the minority, Wayne. Why do people not like going to the dentist?
Well, you know, I think frankly that dentists get a bad rap. It's not the fear of the dentist as much as it is, I think, the needles and the drills. You know, when you see the drill going through a tooth in slow motion and you can see that black ring around the tooth, that's actual thermal damage. It's caused by the heat from the friction of the drill. We don't think about that when we're having our teeth drilled on, but then you hear that high, shrill noise and the vibration and the pressure. That actually creates microfractures that can lead to pain. Just imagine that being your tooth, for example. Think about the heat and the microfractures. You know, that's going to cause pain associated with the drill, and we use the needle to be able to give the local anesthetic so you can have a comfortable experience.
All right, listen, drill, needle, I'm hoping you're here to tell us that technology has changed a little bit since the days of those kind of loud, slow drills.
Well, you know, BIOLASE has really started to redefine surgery and dentistry and medicine. We've actually created a method of being able to work on cavities called WaterLase dentistry, and we can do that in a biological and painless way.
Well, how does it work?
Well, it's pretty simple. We use the water and the light from the laser, and that combines with the naturally occurring water in our teeth, in our bone, and in our tissue, and the combination of that allows us to be able to work and prepare a cavity without that vibration and the pressure and all the other bad stuff.
So let me ask you this then, can you only use WaterLase for the treatment of cavities?
No, actually, there's a lot of different things you can do. For example, you can see this canker sore. I mean, everybody's probably had a canker sore, and you go to the pharmacy and they give you something to put on there. It's kind of like putting salve with sand in it in your mouth. It doesn't feel very good, and it washes out. Well, what the laser can do is it can actually put what we call a laser Band-Aid. Gives you immediate relief of pain and actually allows the lesion to go away, sometimes 3 times faster.
Does it make noise? Because that's the big thing that a lot of people who hate going to the dentist, they hate to hear the sound.
Well, you know, the laser actually makes a popping sound. We found out a number of years ago that there was a special wavelength that's basically on the spectrum of light. We call it 2780 nanometers. I know that's a bunch of science and physics and chemistry, which we don't want to get into, but what really happens is that there's a high level of affinity of absorption in the natural occurring water in the tissue, and this absorption of the water allows the water in the tissue to be vaporized and allows it to start to expand, and then in a very minimally invasive way, the tooth is actually, or the tissue is prepared in a biological way with no pain, nothing associated with it. Now, there is some sound. You're going to hear a popping sound. It's a little bit like popcorn, pop, pop, pop. But we call that pulsing, and it actually happens so fast, and the really cool thing about that is your nerves never get activated to the point of saying it hurts.
This actually may help patients in the long term, because there are a lot of people who, as I'm sure you know, avoid going to the dentist altogether because of their fear.
Well, I think the big thing is removing the anxiety. I think once you can remove the anxiety, then fear really is not an important point. I mean, let's just think about Johnny, for example. He goes to the dentist, and the dentist says, hey, you have cavities on both sides of your mouth. And Johnny finds out he's got to go to the dentist twice. The beautiful thing about the WaterLase is we can actually do it once. The fear that dentists have by working on both sides of the mouth at the same time is that post-anesthetic trauma, if you will, that a child may go home and accidentally bite on a numb lip or a tongue or a cheek. Well, we don't have that with WaterLase because we're not using anesthetic. We're actually able to do this many times without anesthetic and pain-free.
I love that. And so at the end of the day, then, what would you like to leave our viewers with who may be afraid of going to the dentist themselves, or whose children may just be absolutely no way, Mommy, are you getting me to the dentist?
Well, I think the beautiful thing about WaterLase dentistry, and in a biological and painless way, you can have your work done. In fact, we should probably be able to raise an entire generation in kids without ever having to have a shot or a drill in their mouth. That's huge.
Did you hear that, boys? No excuse now. I'm talking to my own children through the camera lens. We're going to the dentist. Wayne, thank you so much for coming on our show and sharing this with us this morning.
Thank you very much for having me again. It was my pleasure.
Good to see you. And if you want to find out if your dentist offers WaterLase or how they can go to the WaterLase website, simply go to the website. It is waterlase.com. And don't forget to keep watching our Dental Discovery series for even more insights on keeping that sparkle in your smile.